important part of treatment of vaginismus, because 80% of vaginismus is because of psychological factor, and if we do not address this factor, then she won't be able to go further in her treatment. Like if we consider if we want to give Botox also, and if we don't consider this part of treatment, then our Botox will fail. So the psychological causes should be addressed. If there is a history of childhood traumatic experience, this has to be recalled. The emotions which accompanied it should be relived in order to help the woman to come to terms with it. We can take help of sexual counselors. We can talk to her for hours to know what causes her pain, what she feels when there is when she faces a sexual when she tries her intercourse, why is she having such kind of fears, and to teach her. Second is sex education, to teach her about her genital organs. The process of intercourse should be taught if she does not know about it. Genital anatomy should be explained. Sexual and physiological behaviors should be explained. Then you tell her firstly on the table that a patient should be in a semi-sitting position with legs apart, and you should tell her to have a look and feel her own sexual organ, experience her sexual organ with her own fingers, alone in a room, with a mirror in front of her. She explores her genitalia either in front of the doctor or alone at home. She can do this so that she gets to know about her intimates. Then you have to tell her to do the relaxation exercises of the adductor muscles to help her relax when anticipated vaginal penetration. The doctor should hold the woman's knees together firmly when she attempts to separate them. Then slowly she is allowed to succeed. This maneuver helps her learn muscle relaxation and eventually allows access to the vagina. Second exercises can be contraction and relaxation exercises of the Kegel's muscle. To gain control over the muscle surrounding her introitus, the patient must learn first how to identify the muscle for herself. She's advised to sit on the toilet with her legs spread apart. If she then starts and she then starts and stops the flow of urine, then she becomes aware of a pubococcygous action. Once the muscle is identified, the woman can practice contracting and repeating it whenever she has time. She simply flexes this muscle 20 times in a row, 3 to 5 times every day till it is firm. So, exploring her psychological factor has a major role, because there have been patients that are given Botox and still they fail to achieve, the only reason being that the psychological factors are not considered and they are not properly counseled. Once this psychological factors are considered and we have counseled her, we have to then do the vaginal desensitization to overcome the fear of vaginal penetration. For these we use trainers. Trainers can be in the form of fingers, commercial dilators, tampons, which are gradually increasing in diameter, specifically designed speculas. The choice depends on the patient and the preference level and her comfort. Gradual should be there. Gradual can be done with vaginal self dilatation, or rapid can be done by mold insertions. This dilatation procedure, we use vaginal dilators for them. Like these are, as they are shown in pictures, they start from very thin dilators to a large XL size. Initially, we can call her to our OPDs and start dilatations with obviously a lubrication is put on the dilators, and we start from a smaller size. We help her put the first dilators, and then she can practice it daily at home. Once she is able to get to a good size, like a larger XL size of a dilator, then the control of these dilator insertions is transferred to husband. We do not jump on intercourse directly. For 2 to 6 weeks, we have to desensitize her by these dilators. Once she allows her husband to dilate the vagina by vaginal dilators, then we can attempt penetration by penis, but the control should be in her hand. Third step is that she controls the insertion of penis, and once that is possible, the fourth thing is that she transfers the control to her husband. So this is a very slow procedure. We cannot lose patience in this. Husband also needs to be counseled, because he needs to support her, and he should not lose patience in all this process, because it takes a lot of time. After that, once the dilate, one if she is if dilator insertion is possible and penile insertion happens with dilators only, then it's good. But if it does not, then we shift to Botox. So, how to select a patient for Botox? It is the one who is not responding to standard treatments, engaged in psychotherapy. As again, I'm telling, very important factor is counseling to address the underlying psychological factors. Those experiencing significant pain or muscle spasm during penetration, making intercourse nearly impossible. So sometimes there are some patients that they allow vaginal dilators, they allow finger dilatation, but the penile dilatation is not possible, or they feel pain while attempting penile insertion. So these patients can also be used, as they can be a good candidate for Botox to minimize their pain. So the very important procedure that all of you need to know is the procedure. Generally, we can do it under local, but under short GA it is preferable because the patient already has fear. She is relaxed and we are relaxed. So short GA is preferred anesthesia for these patients. We start with 100 units of Botox first session. Brands of Botox, as you want to know, are Botox, that is the original brand. Stanox is an Indian brand. There are Korean brands like Botulax, and Xiaomin is a reconstituted Botox. There are all these brands are available. Almost their actions are similar. I mean, 19-20 का फर्क है, बहुत ज्यादा फर्क नहीं है, but cost difference is a lot. Then so this, when you take a vial of Botox, it generally we see that it is empty. There's nothing inside. We cannot see anything, or some deposits can be seen at the base. We dilute it with 6 ml NS, and I take it in 2 separate syringes of 3 ml each. Some doctors prefer insulin syringe as well. So after proper painting, draping in lithotomy position, we inject 3 ml on right side and 3 ml on left side. On the lateral vaginal walls, muscles that should be covered are bulbocavernosus, pubococcygis, puborectalis, which are the areas of maximum spasm. After the procedure, we put an indwelling dilator of the largest size, that is the XL size. We coat it with 2% lignocaine and leave it in situ. So when the patient wakes up in the ward with a dilator inside, she achieves early pain-free dilatation in the recovery area. Like sometimes some patients experience first-time dilatation. Like she gets to know, so this is how it is. The dilatation is there. This is how insertion feels, and there is a flipper switch for her. The patient becomes comfortable with dilatation process, both physically and emotionally. Dilatation progress is quicker, more effective than waiting for 2 to 7 days for Botox to take action and then initiating vaginal dilators. So this is a small video. We can see here that there is just a deposit below. I have diluted it with 6 ml NS and 3 ml syringe I have taken. So while injecting, we go beyond the hymen inside, deeper inside, like 2 to 3 centimeters inside we can go. And we have to inject at 3 points on the right side and 3 points on the left side. 3 o'clock, 3 o'clock, 4 o'clock, and 5 o'clock in a perpendicular manner so that it is injected into the muscle.
A quick question.
Yes, sir.
Do you palpate the muscle, and then just as we feel the ischial spine uh, during this injection local there, do you
Yes,
feel
sir.
the muscle by the tip of the finger and then give it there? How do
Actually, sir, it is we generally, when if some patients allow finger examination, we have to examine them in the OPD only to see where the spasm is exactly. So we have to get to know that yeah spasm hai, and we have to keep it in mind, because once the patient is under GA, we cannot feel the spasm of the muscles. So we have to examine if she allows. If she does not, then these are the points that can be taken blind, like without any palpation, because under GA we cannot palpate the exact muscle. And this half needle insertion deep is okay. So 3, 4, 5 in the right, and 7, 8, 9 on the left. We have to avoid position 6 because there is perineal body there, and the anterior vaginal walls to prevent any urinary and fecal incontinence.
I see that you are not aspirating.
Yes, sir.
So,
Because Botox, if Botox goes into vessels, there's not a problem there.
no, no, it will go
If it
waste.
goes, if
It will go waste. That's why.
yes, yes. Also that, and vessel may be gato, there is no problem.
Okay. Got it.
So, a mechanism of action is it prevents release of acetylcholine at the NMJ, thus preventing the muscle from contracting. The effect lasts from 3 to 6 months. So, this is a very short duration, but once if the patient allows intercourse and she has a good intercourse in these 3 to 6 months, then generally a second dose is very rarely needed for her. Like again, the relapse cases are very rare, so we do not need a second dose generally. Yes, sometimes we use 100 units, and after 7 days, if we examine and we feel that there is still some spasm, or patient says after 14 days that there's still some pain, then we can add on a second sitting with 50 to 100 units of Botox again. Side effects can be excessive dryness, urinary fecal incontinence can occur due to improper injections. So follow, like Botox, after Botox, follow up is very, very, very important. We start with dilators. We do not directly jump to intercourse. 2 to 4 weeks, we use only dilators. Like as I told you previously, first she will use the dilators, and she will hand over the control to her husband. And third, she will have penile control with her, and then lastly she will hand over the penile insertion to her husband. During this time, we have to call her to the clinic 2 to 3 times a week for support, and we have to, if she's not able to do dilatation at home, then we have to practice dilatation in the clinic itself with the dilators. Sexual counseling should be going on with the partner involvement, and most patients are able to have successful penetration in about 4 weeks. The only chances of failure occur if psychological factors are not properly considered. So thank you, and the questions are welcome.
That was sweet. Quick and sweet.
Thank you,
As
sir.
simple as vaginismus, probably. Anyway, any
It
role?
does. It is not as simple as it is,
I know, I know,
because
I know. So, yeah, yeah. Any role in rigid perineum or old perineal scar? You can stop screen.
uh,
Stop screening, madam.
old perineal scars, sir, generally dilatation helps, dilators help, and we have to again examine her in the OPD. If we feel spasm, if she's contracting her muscles because of pain, also sometimes she might contract the muscles and not allow penetration, then we can, yes, inject Botox. But if the scar is paining while penetration, then we have to revive the scar maybe.
Okay. Where can we get the dilators? I think any shop will give them.
It is available on Amazon, sir.
Okay, okay. Simple. Amazon पे सब मिलता है. Anyway, what is the dose per kg body weight or in terms of units? Is this dose same for
Units.
how many? 100.
Units, sir.
How,
100 units first sitting, and we can give till 200, 250, but in the next sitting.
so how many days do you do the second sitting?
Full action of Botox needs 7 to 14 days. So if she might start with some dilatation in these 7 to 14 days, but some, if we feel some spasm again, then we can repeat it after 14 days.
Okay. Okay. And generally, once the intercourse gets going, then she normally doesn't require any other
No, no, no,
second setting.
no,
Okay.
no.
So, say side second setting can be done after 14 days.
Yes, this is for the first thing only, sir. Like the effect will last for 3 to 6 months. This
Okay.
effect, but again, like resitting, or once the Botox effect is lost, then she might not. No, generally they don't need, because the intercourse is going on, so the relaxation is there, or the fear is gone, whatever.
Okay. Oh, yeah. Any contraindications? I think you already told, no contraindication.
No contraindications.
So how much ml is 100 units?
So it is the Botox vial comes with a powder. Very mostly it is not visible. We have to dilute it with NS and reconstitute it or make it into ml. What I prefer dilution by 6 ml so that 3 ml is available for both sides. The vial has only a powder which is not visible only. It appears to be empty. We feel हमें कुछ दिखता ही नहीं है उसमें.
So, so again, please tell us on which side do we inject? 4 o'clock, 5 o'clock?
3, 4, 5
Okay,
and left side में 9, 8 and 7.
okay,
We avoid 6 o'clock because there is perineal body. So the and it is part of external sphincter, so that can lead to fecal incontinence. And also the anterior vaginal wall because of to avoid urinary incontinence.
okay. That is done. So the dosage is by how much can we charge for one sitting? Arey yaar.
So charges can be anything beyond the cost of wires.
So what is the cost of 100 units? Vial?
So Botox company provides it to us in 14 to 15,000 100 units. And the MRP is I think 25 to 26, which is written on the vial, but to us it is at 14,000. Then there is an Indian brand called Stenox that is at approximately 9,000 to 10,000 per 100 units. I'll make a list and also give sir.
Tenox,
There
right?
are certain Korean brands also which are cheaper because Korean cosmetics is nowadays going. So a Korean brand which is a Botulax, we get it at 6,000
Okay.
100 units. And Xiaomine is a reconstituted Botox. It is also available at around maybe 10 to 11,000.
So I think so it's simple. Any cost of any medication to complement the action of Botox?
No, sir.
Okay. Yeah, you can stop sharing, Dr. Mansi, so that
Okay, sir.
you can see
Yeah,
everyone.
yeah.
Okay. How long does the incontinence last, if at all it happens, and how to reverse? That's a good question. So, in case you complicate, in case you
Hmm.
inadvertently inject it at the 12 o'clock position
Hmm.
or 6 o'clock,
Hmm.
so how long
Hmm.
will the incontinence last?
So actually, Botox reversal is not there. We might need to tell her to practice Kegels exercise for muscle strength regaining, and reversal is not possible. And in case mild, see, generally it is very rare that incontinence will happen. But even if it, then 3 months, maybe 2 months, it will last. Effect goes in 3 to 6 months, so it will decrease maybe in 2 to 3 months and will completely be gone by the 6 months.
So, is this synthetic or made with the real Clostridium botulinum toxin?
So
Is it?
what it is made with botulinum toxin. Xiaomine is a reconstituted product, but others like Botox, Botulax, and Stenox is a botulinum toxin. There are reconstituted vials also by name of Xiaomine, Xeomin.
Okay.
Yes, it is the same used for face. Same. We can use these brands for face also.
So, even for this, we have to inject the same 1 ml सब जगह जहाँ पे wrinkles है 1 ml.
हाँ. नहीं. There are points, sir, for those also. On the forehead, uh,
So,
I don't know exactly, but there are two lines they draw in the center, and 4 points in the first line and 3 points in the lower line for the forehead muscles. And there are points for these wrinkles also.
okay.
So,
There
very
are
basic.
specific points.
If I can ask you, Dr. Kiran, is it okay if I ask this question?
Uh,
Um,
Very much
yeah,
okay.
Yeah, actually, I'm asking you this question because the mechanism of action of Botox, it prevents the acetylcholine release, and so it does relieves the vaginismus. So, how does it
Hmm.
work on the face? I mean, to reduce the
So these wrinkles that you see here, it
That's
is because
as
of
a result of muscle contraction. Na?
muscle contractions.
So once the muscles stop contracting, the wrinkles
Stop
go.
contracting.
So they have
So
plastic faces. So those who have this,
yeah, if she raises her eyebrows, these lines will not be appearing. The muscles will not contract, and it will appear flat.
oh, acha, that's why. Okay. I was wondering, because
Hmm.
otherwise, like
before
Botox
we
filler,
come to any conference, 9,000 will be the delegate fee for Botox. So inject on your wrinkles and don't frown on the speakers.
we look better naturally, but then, yeah, if
Yeah,
the
yeah, but
patient,
you should not frown on the speakers. That is the prerequisite when you come for the conference now.
nobody frowns, yeah, it's okay.
So any other questions? Yeah. Has Reshma Mirge joined?
So they use this Botox even for under eye bags?
Yes. There are specific points, ma'am, because there are specific muscles acting on the. It can be also used for blepharospasm or for the under, not for under eye bags, but these muscles like generally for this frown in
Hmm.
the glabellar region for
Mm-hmm.
these cats, they call it
Cat's eye, yeah. Hmm.
yeah. For this and blepharospasm के लिए भी use होता है.
Okay, not for the under eye bags, no?
No,
Okay.
for under eye bags fillers are used.
Okay. Fine. Thank you.
Yes.
I don't think there are any more questions. So,
Sir, sorry if I interrupt.
yeah, Kruti ji, bolo.
Sir, what madam asked Gauri madam, I really didn't understand what is the explanation that why, if the muscles are not contracting on face, then how it brings a flat skin.
Okay. Can you see me?
Right. Yes,
Can
sir.
you see my forehead?
Yeah.
Can you see these wrinkles?
Yeah.
Why are they? Because I'm
Uh,
contracting the muscles. If I don't
okay.
contract the muscles, there won't be any wrinkles. As simple as that.
Okay.
Kind of a plaster face,
Yeah.
kind.
Yeah.
Okay. So I think, yeah, thank you. Thank you, Dr. Mansi. Thank you.
Thank
That
you,
was
sir.
a very
Thank you so
short.
much.
Sir,
Thank you.
Sorry.
vendor, any vendor for injection?
कोणाकडनं घ्यायची?
I will give
Amazon. She told
contacts.
madam Amazon.
Uh,
Dilators Amazon.
that is dilators. I'm
Yes, sir.
asking about injection.
Everything.
There are vendors, ma'am. I'll share the contacts, whatever I have.
So this
Okay,
is
thank
I
you.
think that
Also,
Gynocare also has this Gynocare devices, no? This fellow, that company also
yes,
comes with a representative who has these dilators. So
dilators, yes.
you get the dilators with
Also,
them
the
also.
vendors are different for different cities, but they'll give contact for the particular city that you are in. They courier you also with. They generally send it with the ice packs. They courier you from wherever you are
Okay.
without any extra charge.
So once the vial is open, you cannot use it with other patients.
You can not for you can actually. You have to store it in the fridge, and there is a time span given that after reconstitution it should be used in this much of time. It is different for different bands. Generally 7 to 21 days. You can use it
Okay.
for different patients also.
Okay. Otherwise, we are in loss.
Is there any?
Because no, for vaginismus we have to use 100 units and it comes in 100 units vial only. But yes,
Okay.
for face there is a very small number of units required, so we can use for different patients also.
Okay.
Okay. So I think if there are no more questions, anybody, any other questions for madam?
Sir, I have a question.
Yes, yes, Dimple ji.
Sir, any other uses of Botox and Cosmogyne?
There is a whole book on that. There is a whole
No.
textbook on that. Yeah. There is a whole book on that. Anyway,
uh,
else?
yeah. Okay. Any book to refer?
Can you see my screen? This
No,
time?
no, can't see it clearly.
It's blurred.
So you please share the picture in the group if you want.
Share the,
Yes, sir, please.
it's a very
Yeah.
300 रुपए का group. एकदम simple चीज. I will share it in the group immediately.
Yes, sir, please.
हाँ.
Thank you.
चलो, anything else? Okay, so thank you, Dr. Mansi.
Thank
That
you,
was
sir.
really
Thank you.
nice.
Thank you.
And
Thank
do
you, sir.
remember what I have told you. And once you are ready,
Sure, sir.
once you are ready with that, we will take a PG. We will take a PG class on that particular topic, and you can
Sure.
take that. Huh? Just
Sure, sure, sure.
ping me when you are ready. Okay.
Okay, sir. Thank you. Thank you, sir.
Thank you. Thank you. So it's really a pleasure for me to introduce our. Yeah. Is Renuka there? अरे यार आज के कन्वीनर कहाँ पे है? Is Rainy or Renuka there? Anyway, if can you? Yeah. So it's a pleasure for me to introduce Dr. Reshma Mirge. She is an aesthetic gynecologist practicing in my own city, that is Pune. She is also one of the coordinators of the aesthetic gynecology program that we all are listening to. She's practicing for the last 16 years and as an aesthetic gynecology and director of Riva's Cosmo Gyne Clinic. Uh, She has also undergone training at IIA. Her achievements and recognitions are varied. She has the Women's Achievement Award in 2022, Rotary Club Award for Cervical Cancer Cap, the Lions Club Award in 2022. She's faculty at the University for the Aesthetic Gynec in 2023, faculty at SOGOG, that is All Gujarat OBGY Conference on Aesthetic Gynecology. She's an international speaker and Cosmetic Gynecology Committee member for ISRM 2024, faculty at Gujarat Conference, faculty at Kasoga, awarded by the Lokpat Award for Social Work for HPV vaccination and women's hygiene, and awarded by Spice Award for Social Work in Women's Empowerment. So thank you, Dr. Reshma, for being with us. And Dr. Reshma will be throwing a light on all the shots. So, the different shots that we hear of and we don't know of. That is the G shot, the O shot, the V shot, and the Kama Sutra shot. So, Dr. Reshma, please enlighten us on these shots, how they are given, where we inject them, how do we find the spots.
Yes, sir. So there is a request. Yes,
But
sir. Sir, thank you, sir. Thank you for the introduction. There is a technical hint from my end. I'm actually logged in from my laptop, but I'm not able to share the screen from there. So I would like to share my screen from my phone. Is that okay? I won't be seen. That's fine with me.
you can log in from two devices. On one device, let us see you. On the other, let us hear you.
Okay. Okay.
On the where we can see you, you mute the mic. You mute the mic so there won't be any echo.
Okay.
Yeah.
Just give me a minute.
Well, as madam is preparing for her presentation, if delegates have any questions, issues, please let me know.
बोला काय होता
Yeah. So is my slide visible?
कपले निघाली काय नाही बा
So is my slide visible?
Yes, ma'am.
Yeah, your slide is
it's visible.
Yeah. Okay. Okay.
visible.
Thank you. So my topic for today is all shorts, and I'll try my level best to explain it. So basically, let's come on to the anatomy of all the shorts. Why? Because it is really very
मागे गेला.
important just to understand the functioning of it. The more
Okay.
importantly, we are
आता
going to
चावते का
decode all the spots
काहीच
and the
problem.
shots that we will be giving it. The most important to come back is the nerve innervation of the clitoris, the vaginal part, and onto the cervical part as well. So basically, the clitoris is being supplied only and only by the pudendal nerve supply, while the vaginal part is being supplied by the hypogastric nerve, the pelvic nerve,
Only, Dr. Reshma,
and the
we
G.
first slide,
Yes.
decoding G spot.
Yes, sir. Yes, sir. It's the first slide itself. Yeah. So basically, the nerve innervation really differs from clitoris and the vaginal part. I mean, I'm just explaining that verbally. We'll come on to the shorts. So already, I think so. The previous speakers have already enlightened upon the nerve innervation. I think so. We had it in the first chapter itself of anatomy. So just a brushing. The clitoris is basically being innervated by the pudendal nerve, while the vaginal is being innervated by the hypogastric nerve as well as the pelvic nerve. Why decoding of the G short? Because ideally, when we see onto the next slide, yeah, why the shots and spots are really important in cosmetic gyne, because it is not from now, but it is from the ages that is being said, and it's a very well-known quote being given uh, by Osho actually, that he usually says, "Ki sambhog se samadhi tak," where basically when you are actually having a sexual intercourse or whatever commitment is being there, the it is actually like a meditation in case if you enjoy it in a very right way. Otherwise, it is being said it is not the good way of having it. So let's come on whatever is the introduction for the G short. Basically, G short is nothing but it's called as Grafenberg's spot, which is a spot which is being present onto the anterior vaginal wall, which is near the urethra. It's a highly sensitive area, and it leads to the intense sexual gratification as well as the female ejaculation. And there is no consensus in the scientific community regarding the existence and the exact location and the functioning of the shore. The anatomy of the D spot is really very important. Why? Because it is actually a sac-like structure, a very small grape-like structure, which is being present which is being present as a very small purplish lesion. When we usually do a dissection into a cadaveric thing, we usually see a very small purplish like lesion which is being present onto the anterior part of the anterior vaginal wall. It has basically divided into three portions. That is the upper part, which we call as upper pole, the lower part, which we call as a tail, and the middle part. The approximate length or the dimensions of the G spot is 8.1 millimeter, not even 1 centimeter, and the lowest one is 0.4. It is said that it is approximately being present by say 15 millimeter from the proximal part, and from the distal part, it is 3 millimeter from the urethra itself. So the diagram which is being present and the yellow spot which you can see into the diagram, that is basically.
Reshma, only the first slide is being seen, introducing the G spot. We can't see the.
Okay. So is it visible now?
Yeah, 1 second. Just before we go, have you held your phone in a vertical way or a horizontal way?
So in a vertical way.
If at all you hold it horizontal, probably the slide will magnify. Just try it out. Auto screen
Okay.
rotate. Just try it out.
Yes, sir. Is it okay?
Perfect. Superb.
Thank you, sir. Zoom login is still there from the laptop
It's
also, but
perfect. This
I
is
think so that. Okay. Thank you so much, sir. So basically, the yellow spot, if you see, which is being marked into the diagram, which is just in between the base of just below the base of the bladder, that is the posterior wall of the urethra, and the anterior wall of the vagina, the yellow structure that if you can see, that is the presence of the G short. And this G spot is being very, very important. Why? Because whatever procedures we are going to do henceforth, whatever procedure that I'm going to explain on this is basically when we are injecting on this particular spot. And how to find out? Well, let's go about it. Approximately 56% of the women are being known and are being reported of having the presence on the prevalence of the G spot. Obviously, when according to the age during the menopause and the perimenopausal period, this the sensitivity of the spot definitely reduces, the size of the spot also reduces. It also depends upon the other factors which is being present, that is the genetic factors. One. Second is hormone, which is very, yes, I'll come to the questions at the end. And second is the hormonal influence. Hormones really plays a very important role. It also depends upon the sensitivity of the of an individual, and also the relationship. The slides are not moving. Yeah. It also depends upon the sensitivity, a sexual sense. It also depends upon the sensitivity of that particular individual of having the perception towards the orgasm or towards the arousal, and plus the relationship that she is being sharing with the partner. There are various MRI studies as well as the ultrasonographic studies which has shown the presence of urethrovaginal complex. It means that the presence of the G spot is also being seen into the MRI studies, which I'll be showing on to the next slide. Plus, there are studies in which the vascularity of the G spot or that particular area is being increased when we do some certain kinds of procedures. Let's come on to the physiology. Why? Because it really plays an important role while doing the treatment. As the G spot is being highly, highly innervated and vascularized, and it is being present onto the anterior vaginal wall, it is really very engorged, and there is a small amount of swelling, or there is an increase of sensitivity when there is sexual arousal or at the time of an intercourse. It is normally a very small firm-like structure, not identified anatomically. It is just felt by the palpation method, which we'll see how to do that. And it really helps in increasing the lubrication as well as the arousal when that particular point is being stimulated or is being injected by. Why? The deep Normally it is being said that there are female usually experience there are two types of orgasms. One is clitoral associated vaginal orgasm, and the second one is vaginal associated clitoral orgasm. It is always being said that the clitoral orgasms are really sharp. They are very sharp shooting. They last only for a short period of time because of the nerve supply. As compared to the vaginal orgasm, these vaginal orgasms are really very deep, they are long lasting, and they are diffuse. As to a clitoral orgasm which is being present and which is being experienced only onto the pubical area, whereas the vaginal orgasms, these are experienced diffusely over the anterior abdominal wall, onto the lower part of the uterus, the vagina, and even the upper aspect of thighs. So this is the difference between the vaginal orgasm and the clitoral orgasm. Very important because we are going to do for the other shots also. One. Second, as we have already discussed, that the nerve supply to the G short spot and the O short is completely different. They're being supplied by two different groups of nerves. And any stimulation, any increase in stimulation to this spots can really help in increasing our dopamine and oxytocin release that helps in achieving the pleasure as well as the emotional bonding. The blood supply is going to be from the internal pudendal artery, which really helps in engorging it and making it more sensitive. Yeah. So G spot, it is a legendary spot which is not ideally does not exist. It is being said anatomically, it is not an anatomical landmark that it is being seen as such as compared to the other aspects. But yes, it truly exists. So let's come on to whatever the scientific data which is being available. It is almost said 54 to 62% of the women are being experienced of having the existence or the prevalence of the G shot. And then we'll come on to the MRI as well as the sonographic study as well. Okay. So the diagram which is being shown onto the slide is an MRI picture. This picture, fortunately, is being taken by one of my friend. So when we have done the stimulation of the augmentation procedure that we have done basically on the G spot. Initially, we used to do it by using the fillers, but nowadays we do it even by using the PRPs. We'll come on to this. When there is an increase in the blood supply to this particular area, you can actually see this. Even when you are, when you are having a sonographic machine at your center, you would actually find a difference. When you take the sonographic picture of this area, this particular area, when the patient allows, if the patient permits for the study kind of purpose, then in this particular area, you would see that when the blood supply is really reduced, when the female is actually complaining of some sexual orgasm or some orgasmic dysfunction, you can actually see into the imaging the blood supply to this particular part. And when you call the female after 4 weeks of doing the procedure, you would see that the blood supply to this particular area is being increased. And that is what we have seen into the MRI thing. Okay. So how is the MRI mapping and kind of thing is being done? So basically to detect the G spot, which is being identified by some very hyper intense focus, which was seen in that MRI image. So histological evidence was very well integrated along with the imaging evaluation also. And obviously, when the G spot is being there, 10 to 15% of the individuals you can actually see. It's not possible to see the increase in blood flow in every individual, but yes, when we are actually doing from the study point of purpose, we can actually see the increase in the blood supply to this particular area as well. These are other images of the G shot, where we basically find the location of the G spot, not exact location, but these are some markers that is being used, where we basically see the bladder. This is the lower part, the longitudinal part that you see where there are markers, that is a part of the urethra. The part which is being posterior is the complex. This is a urethrovaginal complex which is being present, where there is an actual location of this G spot, and there is a vaginal area as well. We'll come on to the clinical significance of the G spot or the Grafenberg spot. Usually, it is very important from the cosmetic gynec point of view. It is also important. It's being also being used in the urological sexual medicine. Of course, it plays a very, very important role. Some women with what we usually call as FSAD, that is female sexual arousal dysfunction, or an anorgasmic report, has been sensitive to the G spot region as well. So there are certain pelvic floor therapies that we have been listening to various kind of lectures related to HIFU, HIFIM, and the other EBDs, which really helps in the pelvic floor therapies kind of things, along with the PRPs and the other machineries that is being available. Yes, pelvic floor therapy also helps in increasing the muscle tone and plus increasing the blood supply to these particular areas. Sexual therapy, sex therapy, or the cognitive behavioral intervention also helps to a certain extent. Why? Because the reason of having a sexual or a female sexual dysfunction or orgasmic dysfunction is basically the first most important thing is psychological. Second is hormonal. Third, it could be because of the functional. And fourth is because of the nerve innervation or maybe because of the blood supply. These are the reason of female sexual arousal dysfunction. So any of these reasons can be definitely corrected over a period of time when the patient is actually being presented to us. We'll come on to the urological and the gynec indications as well. We have seen in various things that SUI is being treated with all kinds of different kinds of lasers, along with PRP. To some extent, it can also be treated with even threads, as sir had shown it yesterday, along with some kind of fillers, which we used to use it before, but not at present because PRP is actually taken away into it. So this clitoral urethrovaginal complex, which usually overlaps the G spot, which really plays an important role in urethral continence. The vaginal atrophy, or if there is a weak pelvic floor muscle, or when because of the postmenopausal changes, the rugosity of the vagina is being lost, the sensitivity of the G spot also reduces, and also the incontinence issues that keeps on growing, right? Pelvic pain syndromes, it can be, there are various things which still we can use in pelvic pain syndrome, along with G spot augmentation also plays an important role with the PR. We will more focus today on G-spot augmentations, where we can either, there are some studies where we have been shown that there can be a use of various agent. Either it could be because of the use of which we call as microplastics. Microplastics are nothing but these are the silicone implants being available in the market. They are they are completely safe. They are bio inert. They do not cause any harm, and there is no migration of that particular area. In case if when the patient is actually complaining about the pain to this particular area, we can even remove that micro implants which is being present. Silicone implants, I personally haven't done any case with the microplastics or the micro silicone implants to the G spot. I have done with hyaluronic acid previously. Now I'm using PRP thoroughly with all my patients, and that really helps. So we'll come on to hyaluronic acid, this just for a part of discussion. Hyaluronic acid is nothing but it is available in the form of, say, fillers. It is available by various companies. The most commonest company that I use is the Allergan company, by it being given by the Allergan companies, by Juvederm, by even Restylane, and even the other body fillers company, which is called as Infini. Infini is the name of the company, which even supplies for the body fillers as well, where you can use this hyaluronic acid fillers and inject onto that particular G spot, where it really helps in augmentation of the spot. So what is the intention in doing it is that when we are injecting, we are going to inject onto the urethrovaginal complex, so that the G spot which is being present onto the anterior vaginal wall is being pushed downwards towards into the vaginal canal. Why? Because whenever at the time of sexual penetration, this spot is being touched or is being easily being brushed up by the penis. So our intention is to get the G spot towards onto the vaginal wall, so that the G spot arouses, so that the patient gets easily aroused. So whatever insertion we are going to do, it is either we are going to do on the G spot, or we are going to do just onto the urethrovaginal complex that is just above the G spot, and which is below the urethral musculature and submucosally onto the submucosa of the vagina, right? Postmenopausal vaginal atrophy, as we have seen that there is a lack of rugosity being present to the vagina, and there is obviously the sensitivity is also reduced. Even in this case, we can go for the vaginal rejuvenation of the whole vaginal canal using either the PRPs or the various EPD devices that's being present, along with or without the estrogen treatment. Okay. Yes, the psychological as well as the social consideration, it really plays a very important role, because the G spot popularization has been really being influenced by the media, and even by the social medias, and the what do you say, the magazines and kind of stuff. It is being actually being boosted up. I mean, the fantasy regarding the augmentation of the G spot is really being increased. So whatever could be the impact on the relationship, the woman experiencing the vaginal sensitivity might even lower down her sexual confidence. because whatever the hype is given into the society about the G spot, or maybe about that, the woman might even experience a low sexual confidence into the relationship issues, which can actually be where our things can stand up, where we can actually put up onto the clinic for the augmentation of these procedures. Of course, patient selection really plays a very important role. We have to categorize a patient, what is a group of the patient that really requires the selection for the G spot, for the O shot, for the K spot, or whatever it is. So according to that, the patient selection has to be there, that we will discuss, obviously. And while when we are doing for the G spot, majority of the time when the female is coming to our clinic, we have seen that it is being proposed by the male partner for her to get some augmentation procedure done. It is not only by herself. So we really have to take a consent. The consent plays a very important role, and we really have to take a consent. We have to take a proper sexual history. We have to take the history into the account, whether the female is actually suffering from some what do you say, a sexual orgasmic dysfunction, or she or her partner is, or it is being insisted by her partner, or is her partner being suffering from any of the erectile dysfunction. That can also be a case, because we had a couple of the cases where the female had everything into the normal. There was no arousal, there was no orgasmic dysfunction that she was being suffering, but she was asked by her partner to get some procedure done. For the first instant, we did not understand, but yes, when she was repeatedly coming after 2 to 3 months for the same process, then coming into detail and then going for the couple therapy, that really helped in a very long way. And where we understood that the partner, the male partner, is actually being suffering from premature ejaculation, and along with erectile dysfunction. So taking the couple history or taking a couple therapy really plays a very important role when we are giving any sexual arousal treatment or the therapies. Coming on to the G-spot augmentation, it is a very minimally invasive procedure where either it can be done by using a hyaluronic acid, that is a fillers, what we say, or either it can be done by using a PRP. And that really helps in building, in case when there is, when a female is actually being suffering from any arousal dysfunctions, arousal dysfunction or any sexual dysfunction. Once we have given the G spot or the O spot, depending upon the patient's selection, this really helps in increasing her self confidence overall. And we have seen in many of the cases. And this effect basically lasts for about, say, 3 months to 6 months, depending upon the age of the patient, depending upon the thickness of the vaginal wall, and depending upon the presence and the sensitivity of the G spot to her. So, sometime in the perimenopausal and the menopausal, it might last for 3 to 6 months, but in the early age group, it might last for 3 to 6 months as well. What are the benefits? Yes, of course, it increases the sexual activity, it increases the pleasure, it increases her self confidence. There is hardly a it is a minimal downtime. It is an OPD procedure, it's a quick procedure. There is no bleeding, nothing involved. It is a non surgical procedure, it does not require any anesthesia, just a topical uh, cream using a Prelox, or it could be a top lap, where we usually basically use for a G spot. It is hardly for 15 minutes to 30 minutes before prior doing the procedure. And that is the thing. And yes, we'll be coming on to some shots related to in male as well. What are the potential side effects and what could be the contraindication? Minimal amount of bleeding or the spotting, which is being very normal, and that we have to inform to the patient so that the patient doesn't get scared about that. There is a very minimal pain being experienced by the patient, very minimal, because we are already using a local anesthetic cream, one. And yeah, sometime when we overstimulate, or sometime when there is an over injection by the PRP, it is in a very few minimal amount of cases, like maybe 1 to 2% of the cases, they might have the arousal at the time on the table, or maybe a persistent arousal. Yes, urinary retention is being possible when we are using fillers and not PRPs. And PRPs, we have not at all seen any urinary retention. When we used to use fillers for that matter, which were dissolvable as well, which are dissolvable for the things, but the urinary retention is seen in filler cases,
Dr.
or
Reshma,
maybe in the microplastic.
we still
Yes,
can't
sir.
see the next slide. G-spot augmentation या slide वर आहोत आपण. You have to move the slide.
Acha.
Yeah.
Okay, I'm
We
so
are now
sorry.
on the
Is this it?
We are on the side effects. We miss the benefits.
Yes, sir.
We miss the benefit slide.
Okay.
Ah,
So the benefits that have already been discussed on, that it really helps in the sexual activity, plus it helps in pleasure, and it also helps in boosting of the self-confidence with minimal downtime or no downtime. It is a quick OPD procedure, and it's a non-surgical procedure which can be done with by using a local anesthetic cream. It could be Prelox or it could be Toplap, where we basically have to use this cream at least 15 to 30 minutes prior to the procedure. Yeah, we'll come on to the side effects. Side effects is minimal bleeding or spotting that is being present. We have to inform to the patient. Sometimes there can be persistent arousal, which is more present in the kinds of fillers or the microplastic silicons which they were using it. I personally have not used microplastic silicons at all. Fillers, yes, in the initial phase I did use it, but now it is completely onto PRP. Constant vaginal wetness is because the stimulation of the G spot can really help in increasing the lubrication. For the initial few days, the female might get accustomed to the lubrication which is being present, and that we have to inform to the patient. Urinary retention is present only and only when we were using hyaluronic acid fillers, or even it is being the report is being mentioned that it can also present in the form of silicones. Altered vaginal secretions, yes, the secretion might alter. Sometimes it could be a little bit of dryness and then followed by the lubrication being present. Hypersexuality is hardly seen in any few cases. Hematuria is being seen only when we were using fillers with a large bore needle, which is being present along into the filler kit, which was there, and when we are actually extending it to the base of the bladder. Otherwise, when we are doing PRP nowadays, including the insulin syringe or the BD syringe, hematuria is not at all seen. UTI, the persistent, so we have to rule out the presence of UTI before giving any short augmentation for that matter. Scar formation is not at all seen except in the presence of silicone that were inserted. It's being said, the studies being said that the scar formation were present with the silicones and not with the PRPs or with the hyaluronic acid. The contraindication in the menses, we can't do it because it's during the bleeding, of course we can't do it, and we can't even do it in the active phase when the patient's already suffering from urinary tract infection, where we basically have to rule out any urinary tract infection before going for any augmentation procedure. We have to examine the patient prior to see whether there is any kind of vaginal discharge or any kind of infection being present, or any kind of herpes infections, or any. We have to rule out by doing the pap smear test, even the HPV test, whether the patient is suffering from any kind of neoplasma of the genital tract, any coagulation disorders, especially while doing the fillers. When we are doing the fillers, we have to really, into the history taking itself, we have to ask the patient of any history of DVT or any history of any coagulation disorders being present, any chronic infection, or even in pregnancy, it is completely contraindicated. This is like sex without meditation can only reproduce children. Sex with meditation can really give a new birth and can make a new human being. That is a code which is being given by Osho, and that's a reason we are more concentrating now on G spot and the other spots as well. Yeah. When we are dealing with spots, it is basically when we are dealing with the orgasmic dysfunctions. The patients are, how are we going to come onto the selection criteria? We are going to deal with it, whether the patient or what kind of orgasmic dysfunction is the patient having. One. Second important thing, either when the patient is already having a fake orgasm, means many of the time it is being said almost 60 to 70% of the female, they have fake orgasm. Orgasmic gap, there is a huge orgasmic gap between a male and a female. The time taken by a male to have an orgasm is hardly being said between 3 to 7 minutes, while for the female it is much beyond that, it is much longer than that. What is core micromesh? Core micromesh is nothing but it's a micromesh which is being inserted onto the G spot area for the augmentation procedures, and the other, which is not at all important. It's okay if we skip that. We'll skip even the criticism and the controversies being present. We'll come on to the vaginal rejuvenation. Vaginal rejuvenation really plays a very important role in dealing with all the spots. it's not only that we are treating the patient only for that particular O spot or G spot or K spot for that matter. We have to treat the patient in general. We have to know whether the patient is really suffering from any laxity, the vaginal laxity, how is the thickness of the vaginal wall, how is the rugosity being present or not present, and any kind of the other associated complaint being present. Either it could be SUI, either it could be urgent continence, either it could be a sexual dysfunction. So complete whole history taking really plays a very important role when we are going for any augmentation procedures for that matter. And we need to know what is the choice of the patient, whether she wants a surgical or a non-surgical options that is to be given. The vaginal shots really aims in having a healthy vaginal tissues around. So there are certain shots which we usually call as PRP for the vaginal rejuvenation, where we basically give the spots shots onto the vaginal PRPs onto the whole vaginal canal, where we basically divide into the anterior vaginal wall, the posterior vaginal wall, and we create a mesh or a grid, and we usually give that particular areas so that to have a complete vaginal rejuvenation. The other popular things are the O shot, which is called as orgasmic shot, then the hyaluronic acid fillers. We can even do by using a fat fillers. Personally, I haven't done by using a fat fillers because PRP itself is giving a very excellent result. And then just an hour before, we have seen the lecture for Botox on vaginismus and dyspareunia. Let's come on to O shot. So O shot is nothing but it is called as orgasmic shot. It is again a very minimal invasive procedure where we know how to prepare. Now, till now, at least we know how to prepare a PRP. PRP is being prepared with the same way where we take a patient blood sample. Obviously, whatever the amount of PRP we are required to produce, we exactly. For example, in case if we are taking 50 ml of the whole patient blood, whole sample, we usually get only 5 ml of the PRP. It is almost 10% of the whole blood sample. With the amount of PRP is only 10% that we achieve from the patient. So basically, PRP, as we all know, that we have seen so many of lectures on that, that it really helps because as it present with the growth factors, the endothelial growth factors, it really helps in increasing the blood supply to that particular area. Plus, it helps in neocollagenesis. So that's the reason the shots that we are giving is basically stimulating that particular area with increase of the blood supply and increase of the collagen. Let's come on to the procedure. It is a very small OPD based procedure. The O shot is basically nothing, but it's a clitoral shot, and it's being basically given in between the clitoris and the upper part of the urethra. I mean, the clitoris and the upper part of the urethra. And there are some paraurethral shots along with that. We can also give the PRP is also being inserted into the paraurethral shot also. What is the benefits of giving a O shot? Again, it helps in increasing or achieving the orgasm. It really helps to boost the libido, helps with the recovery from childbirth, any kind of say normal vaginal deliveries or any kind of surgeries being undergone. So that really helps from recovering of it. Like that is post-natal recovery. One, it reduces the dyspareunia as well. It increases the urinary consistency, and definitely it also helps in improving the family. Okay. PRPs, we have seen the benefits of the PRPs. PRPs are being basically used for vaginal rejuvenations, vaginal tightening. It is being used for SUIs. It is used for vaginal dryness. It is used for loss of libido. It is used for dyspareunia. And many conditions. I mean, I would name where I basically take off the classes. PRP is used for all the procedures. To start with any procedures at your clinic, or to start a cosmetic gynec clinic really does not take much of the finance when we are worried about the more about the finance. PRP is the simplest solution where you can actually start practicing into your own clinic, where you might have a coexistent lab or the existing lab, or just buy a centrifuge machine. That is more than enough, along with the Falcon tubes. That is what you require to start with the PRPs. And it really gives a very amazing result. One of my patients, she's thoroughly doing PRPs, only and only PRPs to start with. Of course, now she has got all the other machines also. But yes, PRP is an excellent procedure and really gives a very good result when you do it in a proper formulation. I think so that is being explained by Dr. Prabhu, Dr. Prabhu Mishra sir. I will not go much into that detail. So is it because it is the same way that we prepare it? Yeah. The other method of vaginal rejuvenation, why? Because it really helps in sexual augmentation as well. Because if the rugosity of the vagina or the thickness of the vaginal wall increases, the blood flow to the vaginal wall increases, obviously the sexual function of that particular female will also increase. So either we can go by the other devices that's being available. It could be radio frequency, it could be MNRF, that is radio frequency with microneedling, that is being available nowadays. Either it could be CO2, either it could be erbium laser, or only and only with PRP also we can get it done. Or with the EVD chairs also, that is the HIFM chair and the other chairs. Yeah. Surgical methods, we all know there are some, the pre and post videos, pre and post photos that I have at the end of the thing, which I would be showing it. Labiaplasty, vaginoplasty are common procedures, surgical ways. But now let's stick on to the shots that we were dealing. Yeah. So, case shot, as we all know, Dr. Navneet Megan sir, he is actually legendary in this field. So he is the one who was being invented this shot, which is called as K shot. Is nothing but the Kama Sutra shot. Again, it is a non-surgical procedure where we inject the PRP into the multiple fields. What are the multiple fields? That we inject into the G spot, also we inject into the clitoris, which is again a O shot, and then we inject into the upper part of the vagina also. And obviously, because we're injecting into this particular area, that increases the lubrication, that increases the blood flow, and it also helps in sexual augmentation. These are the other procedures that we also do it along with what we call as 360 of cosmetic gynec. Yeah. So let's come on to. Okay. So let's come on to like what are the, this are the procedures that we do day in and day out. People were actually asking what are the threads and kind of stuff. So these are the threads. Basically, in the first picture, if you see, we are using the cork thread for the facial lift. The same kind of thread we basically also use it for the breast lifting, and the other part, the vaginal part, or the single thread technique that I was talking yesterday about is like where you can do the vaginal tightening with the single thread technique. The second picture really reveals about the BB glow. Comes into the facial part. So these are the threads that we use. We have the breast augmentation done for this particular patient, and the breast uplifting also done by using the fillers as well as thread in this particular patient. The other part of the treatment that we do, yes. This is a picture. This is the pre and post picture. The pre one, it's showing the labias, the labia minora hypertrophy, and then we have done the labiaplasty for the other. It is immediate post-operative picture, and the second slide shows the difference between the hyperpigmented underarm patches and the difference after doing the chemical peel. Yes, people were asking about the fillers. Do we do fillers into the what do you say, the labia majora augmentation? Yes, we have done for many of the patients. This is one of the picture. In the first picture, if you see the marking which was being done, this is the marking which we have done to show that there is atrophy of the labia majoras. And after doing the fillers, I can show you the cannulas. Today I have with me the cannulas and the needle that we use it. Basically, we insert the fillers. I use the fillers from the upward direction, so that the chances of infection to the filler is really less. And you can find the difference that there is an increase in the good volume of the labia majora. Same picture of the labiaplasty. This we have done fillers before and after use. We have done the augmentations of obviously the buttock area. This is a microneedling procedure that we do. These are some classes that I run into my center, where we show all the EBDs and all the procedures, including the facial PRPs, the hair PRPs, the PRPs for stretch marks, and all the EBDs devices. For the vaginal tightening, labiaplasty, vaginoplasty, everything is being done. This is the course thing I can share with sir, and these are my students. And thank you so much. Yeah, I would like to even just touch upon one particular point, that there is also a shot which is called as P shot, which is called as preparaceous spot, which is basically used in male. So similar way, whatever the PRP preparation we are having in female, the same PRP preparation we do in male, where we take approximately 60 ml of the whole blood sample. We do the PRP preparation. We get approximately 6 ml, approximately 6 to 7 ml of PRP. In this way, in this way, we usually inject onto the penile length so that it actually helps in increasing the length of the penis. It also helps in increasing the girth of the penis. I unfortunately have missed putting that, but I can share with Sir regarding the slides and whatever the things are there, even with the images, where we tie a tourniquet at the base of the penis, of the flaccid penis. Tie the tourniquet at the base of the flaccid penis for at least a 10 to not more than 10 minutes, where you and measure the length of the flaccid penis, including the girth. Then you inject the PRP in 3 different areas onto the either side of corpora cavernosa, directly onto the body, inside the body of corpora cavernosa. Obviously, we have to apply a pre-lox anesthesia. It could be pre-lox, it could be top lap for at least minimum 30 minutes prior to the procedure. After measuring the length and girth, apply the anesthesia, wait for 30 minutes, inject the PRP in 3 different particular points, 3 ml of PRPs. Once we inject it, I'll ask the patient to visit after 4 weeks. You could see the result after 4 weeks. Obviously, whatever the sexual dysfunction that the male are going to have related to the premature ejaculation, especially for erectile dysfunction, it works magically. It also helps in increasing, to some extent, it also helps in increasing the length of the penis and the girth of penis. Initially, fillers were used, but as the chances of fillers having what do you say, not migration, but is the chances of having fillers embolism are there when we are using into the penis. That's the reason we are using only and only PRP in case of P shot or the papacious shot.
Well, enlightening.
Uh,
Thank you so much.
yeah, I'll just conclude it, sir.
Yeah.
V shot is basically the vaginal shot that we have seen. O shot is an orgasmic shot, and the K shot. These are nothing but these are the advancement present in the cosmetic gynec. And that really, these are minimal invasive procedures, all the OPD procedures that you can do day in and day out. This does not require any instrument or any machines for that matter, except a centrifuge machine. You can start practicing once you have done a proper training, or once you have seen at least into a proper training, you can literally start practicing onto your OPD, onto your day-to-day OPD. It does not take much period of time. Max to max, it takes only half an hour to 45 minutes for the sample preparation, with the injectable hardly 10 to 15 minutes. Once you are used to it, hardly it's a procedure of say 10 to 15 minutes. But yes, it gives a very, very amazing result. If you're comfortable with the fillers, you can go ahead with the fillers also. But the chances of filler embolism can be there when we are doing, especially for G spot or for the penile shot. That's the reason we are important to. It's better that we really start with. We can start with PRP. And yes, obviously the demand into this field, into the sexual medicine, it really plays an important role in the sexual medicine as well. And the demand is definitely going to increase over a period of time. Thank you. Thank you so much, sir. I can take up the questions now.
Thank you. Thank you. Doc, you can stop sharing the screen so that if we
Yes, sir. Yes.
Renuka, are you there? Is anybody of the coordinators there? Sure, then I will ask the question. Okay.
Yes,
So,
sir.
yeah. So coming to the questions, just share where the P, the O, the KS shots are there in a single slide that you have mentioned, so that I will share it with all the delegates.
Okay, sir. I'll share it. I'll share it.
Commonest question. Okay.
Yes.
And also the videos of the O shot and the KS shot.
I have certain videos that I have taken during my
Share
clinic.
it with me. You
So
please share it.
yeah, I'll share it.
Yes.
I'll share it.
Now my question is that when you said that you have to inject for the vaginal rejuvenation or the O shot or the P shot, you have to inject at the apex of the vagina, correct?
Yes, sir. So basically, it's the anterior vaginal wall that's being present,
Yeah.
and the posterior part of the urethra. So we have to have with the angle of say 35 degrees. So the needle is pointing upwards into the parallel direction. It's actually parallel to the urethra, but it is pointing into the upward direction as well, with the angle of 35 degrees to the urethra. With the angle of 35 degrees to the urethra to start with, and then it goes parallelly.
Yeah. Now, the question is that whenever, if at all we see the physiology of intercourse, initially only the initial 3 to 4 inches of the vagina is that what matters. So why do we inject it at the upper end and why not at the lower end?
So basically, if you see the anatomy of the G spot, it is said to be approximately midway between the between the vaginal introitus and the cervix. So definitely. So at the time, I mean, once the penetration is being there, so normally the glands or the tip of the penis usually brushes of that particular area, and that really helps in the arousal and even the further procedure, the whole of the orgasmic procedure.
Yes, yes, yes. That I understood. See, that I understood. What my question is, when we spoke about the KS shot, that is the Kam Sutra shot of Dr. Navneet, then at that time, I think you mentioned that it has to be injected at the apex of the vagina.
So it is not at the apex of the vagina. It is basically a K shot is a composition of G shot, O shot, and plus a P. I mean the posterior shot, not P shot, but the posterior shot, which is being present onto the posterior wall of the vagina.
Okay,
So you're covering the anterior wall, you're covering the posterior wall, and you're covering the clit as well.
okay, 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 okay. Okay. Now, so when we give these shots, I mean, roughly what is the time frame when we can repeat them, or they need to be repeated?
Right. So in the case of perimenopausal and postmenopausal women, we usually repeat it after 3 months. But in the case of a very young female, a middle-aged female, we can repeat it after 6 months to 9 months.
Okay. Okay. What if it is going to bladder? It doesn't happen anything. Yesterday we learned that even if PRP goes into bladder, nothing happens. What if hyaluronic acid goes into the bladder?
So because hyaluronic acid, it's basically forms over a period of time. So when I am teaching to the student, I usually say hyaluronic acid is like a clay. So it really forms over a period of time. For example, if we are injecting the hyaluronic acid now, it's in the form of semi-solid state, and over a period of time, it really toughens. So it is really not advisable. So chances of having the urinary retention actually increases. So that's the reason the use of hyaluronic acid into any sexual augmentation is being reduced. Rather than using hyaluronic acid, we are using PRP nowadays more commonly.
Okay. So how much filler in the G shot? Which needle?
Okay. So when we are using for the fillers, initially when I used to do it, normally even 3.3, there are markings onto the fillers, where the filler is basically present as a pre-filled syringe of 1 ml each. If you're going for Juvederm, it is being present as pre-filled syringe of 1 ml. So even the 0.3 markings are more than enough when you're doing it for G-shot. And the needle they are being provided, they already have the separate needle for them. The remaining of the fillers also you can use for the other augmentation procedures, but the size of the needle is approximately 26, depending upon the company that you're purchasing. It's 26 to 30 mm.
What is the cost of commercially available hyaluronic acid? How much is needed to get injected, and how frequently it needs to be repeated?
The hyaluronic acid, the effectivity of the hyaluronic acid is present from 1 year to 1.5 years, depending upon the company that you're using. So there are many Korean companies and Chinese companies also being available, which last for about 8 months to almost a year if you're going for Korean and Chinese company. But if you're taking a very good company, say Infini for that matter, which I use it day in and day out, the second company which I would suggest is for thread, it is Mint, and even Juvederm for that matter. So when we are using Juvederm or Infini lasts for 1.5 years and Juvederm lasts for at least a year. I mean, that is what I've seen even when I've done the follow-up of the patients. So that is there. And the cost of Infini is approximately 16,500 for a filler, which is about 10 ml, because these are body fillers. So it is about, including GST, which goes near about, say, 18,000 one. For Juvederm, it is 18,000 for 1 ml. But obviously, these are different fillers. These are body fillers, and these are the fillers which you can even use for the G-shot augmentations also. And how frequently? Juvederm, you have to repeat it after 12 months, and Infini, you have to repeat after 1.5 years.
Yeah. I think if at all you could share the names of the vendors, the names, the trade names which you already told, and of course the videos, then we all will be
Yes,
really
sir.
happy. And one more thing you mentioned about your training program. So if at all you have got any flyers for the training program, please share it with me so that I will share it to the group so that those who will take the benefit of that, they will do so.
Sure, sure, sir. I'll do that. I'll do that.
Any other questions? Anybody? The chat box is open. Yeah, now the meeting is open. In case there are any questions, please let me know.
But for an O shot
Ah,
that you're giving,
Gauri, can you repeat the question?
I'm sorry, but for an O shot, what is is there any anesthesia that is being given?
No.
For O shot, basically, you don't have to give any local or any injectable anesthesia as such, because you will be just applying the cream, the topical cream that is being required. So the topical cream that you use, either it could be a Prelox or either it could be a Toplac, which both the composition are almost similar. The vendors only differs, but that you need to apply at least 15 minutes to 30 minutes prior the procedure that you do.
Yeah, thanks. Thank you.
Yeah.
After how many days or hours can she have a sexual intercourse after these shots?
So when we are doing the PRP, we usually say not to have the intercourse on the same day. You can have the intercourse even the next day. There is no problem because there is no bleeding or spotting at all. Only on the same day she might have a little bit of spotting. But when we are using fillers, we usually restrict for a period of at least 10 days because the fillers takes the time down to settle it. It really settles down within 2 to 3 days, but at least 10 days is the perfect time period for if you're using a fillers for that matter.
From your session, I just came to know that PRP is much better than fillers. Is it
Yeah,
so?
because to start, yeah, because to if to start with the practice, you should start with PRP, and because it is very convenient, it is very easy. In case if you even intend to just cross onto the vaginal walls or getting into the base of the bladder or into the urethra, PRP does not cause any harm for that matter. But if you're injecting fillers for the first time, it has to be under the proper guidance, or it has to be done very meticulously, because if the fillers are injected accidentally either into the urethra, the comes I mean get through and through the urethra, because it is a sharp needle when we are using it for the fillers. But when we are using the same filler into the breast, these we have a particular kind of cannula so that it do not go through and through. But when we are
Okay.
using for G shot, we use a needle, a proper needle, so it can pass through the urethra
That's
or to the
our
base of
routine
bladder.
needle, right? The routine needle.
Normally, there's a proper kit available where we have a pre-filled syringe of the filler along with two extra needles being provided by the company itself, by the vendor itself.
But
So the
the
same
for
needle we have to use.
PRP, we are using the routine syringe and
Yeah,
needle.
for PRP, you are using a routine needle. That is okay. So that's what I said. When you're using for PRP, no problem. You can do it right and left. But when you're using for fillers, you have to be very meticulous.
Okay. And is there a temperature regulation for PRP? After we prepare
Yes,
the
as we have.
temperature,
Right. So whenever PRP is being prepared, it is prepared under the temperature control guidelines. Initially, we prepare it under 20 degrees Celsius when we are preparing the sample. Then we get back to a normal room temperature, and then we use it because of for the activation of the growth factors, which is important. And once you prepare the PRP, that has to be used within 15 minutes onto the room temperature. Beyond 15 minutes, there is going to be degradation of the growth factor, and the PRP won't be of much use.
so the routine centrifuge machine will suffice the purpose.
Normally, there is a proper control. In case if you want to get and achieve a very good result of the PRP, the proper centrifuge machine is being available with a temperature control inside that, which is an insulated centrifuge machine. A normal machines, Remy machine, it usually comes in the
Yeah.
cost of say 8,000 to 10,000,
Yes, yes,
which is for say six chambers inside that. But
yes.
when you're going for a temperature controlled machine, that the cost nearly about comes say 80,000 to 1 lakh. So that gives a better result because you are doing it into an insulated. Yeah, that's a huge difference because you are doing it under an
Yes.
insulated thing, and there'll be a temperature control when you are doing even the preparing when you're preparing the sample as well.
Okay, thank you.
Yeah.
So are you using PRP for keloid scars or even post-cesarean scars? No, for those cases also, are you using PRP, and even for melasmic patches?
Yeah. So I would say there is certain for melasma, I will come on to detail. But yes, for scars, we are using a PRP. There is nothing which is being shown that it increases the formation of the collagen and the keloid scar might increase, not at all. When we are doing some micro injuries to that, of course, the keloid might get increase in size. But when we are doing only PRP, the keloidal scar does not at all increase. Even for the stretch marks, we are using PRP, and it really has given a very good result. It is not a complete abolition of the stretch mark, but at least say 60 to 80% of stretch mark are reduced, including when we are using PRP. We use PRP along with micronailing so that it gives a much better result in stretch marks and any scars for that matter. And when you're talking of melasma, now there is something which is called as what we say is where we use PRP along with Botox in a combination of Botox. So that nowadays we have seen that it is giving a much better result as compared to the other thing. Of course, there are certain supplementations also we give, or certain kind of IV therapies also we do. We are also much into nutraceuticals, also IV nutraceuticals, where that actually helps in improving, giving a very good result for melasma along with IV nutraceuticals.
So you inject PRP along with Botox.
Yeah, we inject PRP along with microbotox, that we say microbotox. We inject some part of Botox, a very small content, depending from patient to patient and the area that we use. The proportion will change, the dilution of the Botox and the PRP we are using, but it is giving a good result.
Role of
Along with IV.
chronic ulcers or wound gaping?
Yes, a PRP really gives a very good result in chronic ulcers as well. So this injection, whatever the PRP that we prepare it, the same form of PRP we're injecting into the chronic ulcers. We either go for the debridement and then we inject the PRP. That itself gives a good result. Or there is one more treatment form that's being available that is called as vacuum therapy, where we usually put the vacuum machine onto that along with a course of antibiotic. The antibiotic also running through that. So that has given a good result.
How will Botox help in melasma?
So basically, these patients are all perimenopausal. One, they have wrinkles along with under eye bags and even melasma. We are using micro Botox because that actually helps in relaxation of that particular portion, not the proper Botox that we usually use it for the forehead wrinkles, the claws, and the beneath line. Not the exact Botox, but we use in a very micro form, so that helps in little bit of dilatation of that muscles and it really unclogs it. Along with IV nutraceuticals, it is giving a very good result.
So IV nutraceuticals meaning IV glutathione and ascorbic acid.
Yes, it is IV glutathione along with ascorbic acid. Even we have a different drip using L-carnitine and N-cysteine as well, N-acetylcysteine as well.
Okay, again, which is the name of the centrifuge company which will give the temperature controlled spin?
So I'll share you the brochure of it.
Yeah. Yeah. So you need to share now four things. One is the video, two is the
Yes,
location of the
yes, sir.
B, K, S, and also the Reshma shot, whatever shots. And three is the flyer.
Actually, yeah, in the clinic, over a period of say 4 to 5 years, there is a particular I usually say it as our zone because that is what I have found that is giving a good result in the patient. I usually inject PRP around the skin's gland also because it really helps in lubrication and it helps in augmentation along with G-Shock. So I give I won't call it an R zone or R shot at first, but yes, that has really given a very good result when we inject PRP around the Skinner's gland. So yes, I mean I can think about R shot.
Okay, but then how do you locate the skinny glands?
So skinny glands are visible when we meticulously see it. It's actually being visible. There are like two dots onto a space between the clitoris and the urethra. There are two small dots. I mean, it's also visible properly in the patient if you really meticulously look for it.
Okay, okay, fine. Kaushik has given Remila B World. I don't know what that means exactly, but anyway.
So it's Remy
Remy,
Lab, Remy Lab
Remy
World.
Lab World. Okay,
Yeah.
okay, okay.
Yeah, yeah.
Yeah, but Remy will give you the routine this thing, no?
So they have a cooling centrifuge also, sir.
Okay, okay, fine.
The Remy also has an insulated one. And there is a one more company which has it. I'll share the brochure. Now I'm not recollecting the name of it, but yes, I have the brochure. I'll share the brochure with you.
Yeah. So acha, there's another question. Any role in chronic Bartholin gland infection?
So any kind of when we are doing PRP or any augmentation procedure, we have to rule out the other infections. So in case of a Bartholin gland infection, we have to either rule it out, or in case if it is being present, either we have to treat it by whatever by the course of antibiotic or mass stabilization procedure that we have. Yes, we do not do PRP when there is any kind of infection at present.
Okay. Okay. I think if there are no more questions, I don't think there in detailed dose of IV nutraceuticals. Oh God. We will have a different.
So there is a huge list of IV nutraceuticals that now we are practicing, including the
I know.
Gluta, I can say, which is a commonly used one. Yeah. Gluta is basically 600 to start with. We can even go max to max. I mean, depending upon the patient's condition, we have even given almost say 3,600 also
Can you
in one
also
single use.
yeah. Can you also share the video of PRP preparation?
Yes, yes, I can do that. Yes, I can do that.
Thanks.
Yeah. Anyway, so if all are done, I think we can close the meeting. We are closing 15 minutes prior, so you can enjoy a walk, take a walk. So anything else? Anybody else? Anybody wants to ask any questions? So if we are done, we'll call it a day. I'll close the meeting for everyone. Thank you. Thank you. Thank you, Dr. Reshma.
Yes.
Thank you for wonderful coordinator and a wonderful speaker. And thank you. And as I said, please share all the shots, the vendors' names, your flyers where you are conducting those workshops for our delegates, so that in case anybody wants to take benefit of that, they can do so.
Yes, sir.
Thank you so much. Thank you. Thank you. I'll end the meeting
Thank
for
you.
all. See
Thank
you
you, sir.
tomorrow, 8
Thank
o'clock.
you, sir.
Thank you.
Thank you. Thank you,
Thank,
sir.
thank you.
Yeah.